The latest data from the Ohio Department of Health is confirming once again coronavirus is hitting our state's African American and Latino communities especially hard. For example, African Americans make up 13 to 14% of the state population, but account for 26% of Ohio's COVID-19 cases. Today, Governor DeWine launched a minority health strike force to address that disparity. But as 5 on Your Side investigator Joe Paganakis reports, some minority health experts say it may not be enough.
Rob, the governor says his minority health strike force will improve data to further identify COVID-19 vulnerable minority populations to better protect these communities from coronavirus statewide.
The African American community has been disproportionately hit by this COVID-19 virus.
Ohio Governor Mike DeWine unveiling a strike force to reduce the state's racial health disparity, further highlighted by the coronavirus pandemic. African Americans now make up 17% of Ohio's COVID-19 deaths.
African Americans also account for 31% of COVID-19 hospitalizations in Ohio.
Hypertension and diabetes and overweight and kidney disease.
Dr. Lolita McDavid with University Hospitals outlines some of the health issues she says fuel the Ohio health disparity that has plagued African Americans for decades. McDavid on the strike force committee and says the plan will expand COVID-19 testing capacity for minority communities, use data to prioritize resources in communities that have the greatest need, launch expanded COVID-19 outreach and education, and create more state staffing.
A position within the health department who is basically going to be working solely on social determinants of health and how this links to the COVID epidemic.
Dr. Virginia Banks and Northeast Ohio Infectious Disease Associates issued a report on Ohio's health disparity last week. Banks applauds the governor's plan, but says without significant funding, the strike force won't be able to address core health issues that have perpetuated Ohio's health disparity for generations.
Let's start with the basics. People actually having some place to go to get care. You know, the lack of insurance, the lack of being able to afford to buy your medications.
And Governor DeWine says the Minority Health Strike Force will have a preliminary report posted on the state's COVID-19 website in the coming days, with final recommendations to be issued on June 11th. I'm 5 on Your Side investigator Joe Paganakis.